Today we will be studying the important images asked in the pathology section. The first image is of HTLV-1 leukemic cells. HTLV is human T cell leukemia virus, human T cell lymphoma virus. So how we will identify the histological slide? In this slide, basically there will be flower shaped cells and nuclei. So from this we will identify it. Then the next image is of Mallory Dank bodies. Mallory Dank bodies, these are composed of tangled collection of intermediate filaments including ubiquitinated keratin 8 and 18, and it is associated with alcoholic liver disease but can also be seen in non-alcoholic fatty liver disease. So basically in this, the Mallory Dank bodies, that is cytokeratin 8 and 18, will be there. It is seen by this pinkish. It will be marked pinkish in the image, like this one, and it is basically seen in alcoholic liver disease, but it can also be present in non-alcoholic fatty liver disease. Then this slide is of Lofgren syndrome. Lofgren syndrome is basically linked with the condition named sarcoidosis. It has hilar lymphadenopathy, acute polyarthritis, usually ankles, and erythema nodosum. So in the Lofgren syndrome, we will have these findings. There will be lymph nodes in the hilar region. There will be polyarthritis, and the main joints which will be involved will be ankles. And there will be erythema nodosum, means painful nodule-like masses on the legs and in the skin. So Lofgren syndrome, sarcoidosis. Then this is image of interstitial nephritis. Interstitial nephritis, basically image of the glomeruli will be shown, and the nephritis in the inflammation in the interstitium. Okay. Then this is image showing the tumors linked with the Lee-Fraumeni syndrome. Lee-Fraumeni is basically linked with the P53, and P53 is a tumor suppressor gene. So when P53 will be damaged or mutation will be occurring, then the following cancers can be caused: breast, brain, soft tissue, osteosarcoma, leukemia, and lung cancer. So how we will remember? Like the mnemonic is blood, brain, bum, and bone. The mnemonic is bees. Okay, from the blood, leukemia; from the brain, brain tumor; bum means soft tissue sarcoma; bone means osteosarcoma; and the other one which is left is lung cancer. So in Lee from many, L for lung, and the four B's. Then this is the image showing the stellate cells or ito cells. Basically in the question, what it is asked is, what is the position of the ito cells or stellate cells? These are the cells which are responsible for the cirrhosis. So here we have hepatocytes, then we have sinusoids. In between the hepatocytes we have the blood capillaries that are known as sinusoids, and sinusoidal epithelial cells are here. In between the sinusoids, means in the lumen of the blood vessels, we will have Kupffer cells and lymphocytes. And the space between the sinusoids and the hepatocyte is called space of Dissay. In this space, the stellate cell or ito cells will lie. The next image is of metallosis. In the metallosis, what is metallosis? Firstly, we need to remember about that. The metallosis is basically condition in which like artificial implant is used in the orthopedic condition like knee replacement, and that implant will undergo the process such that the blackish substance will be deposited in the joint space. That condition is called metallosis. And in the histological section, what we will see the blackish pigment. So basically in the question there will be history of the implant or the knee replacement. The next image is about the chromosome. What are metacentric, acrocentric, submetacentric, and telocentric chromosome? In the metacentric, the two arms are of equal length, and in the submetacentric, one arm is somewhat shorter than the other. not of equal length, but one is somewhat shorter. While in acrocentric, one arm is much shorter. Means there will be very much difference between the length of the arms. Then telocentric. Telocentric is each chromatoid has only one arm. Centromere is at one end of the chromosome. Here means only two arms will be present. Okay. So we need to remember which chromosome are metacentric, which are acrocentric. The first for 1, 2, and 3 chromosomes that are metacentric, and then is 19 and 20 are metacentric. Then 13 to 15 and 21, 22, and Y chromosome. These are acrocentric. Other rest are submetacentric. How we will remember? One, like imagine 1 to 20 numbering we are taking. So first 3 and last 2 that are metacentric. Then in the acrocentric we will take 13 to 15 and 21, 22, and Y. Then this is the banding techniques for the chromosomes shown. The different banding techniques are G banding. G banding is treat G banding is basically the G bands are darkly stained. The treat metaphase spreads with trypsin enzyme that digests part of chromosome protein and observe under the light microscope. Then it's Q banding. Q banding is basically used for Y chromosome. Their bright fluorescent bands on exposure to ultraviolet light, same as darkly stained G bands. Okay, the position where G bands were lying here in the Q banding, it will give fluorescent pattern. Then in R banding. In the R banding, R is for reverse. So it will be reverse of G banding. Like which areas were stained dark in the G banding, that will now be stained light. Then is C banding. C banding is used for staining of the centromeric region. So the basic we need to remember is G banding, then reverse of it is R banding. If it is fluorescent, then it is Q banding. And Q is for Y chromosome. Then C banding is for centromeric region. Then this is the image showing entosis. Entosis is basically taking place in organism named Listeria. Here initial adhesion will take place, then cell internalization will be occurring. Then this is image showing erythema migrans. Erythema migrans is caused by Borrelia burgdorferi and it is also known as Lyme's disease. What it will present as bullseye appearance. Bullseye appearance like target appearance, and there will be deep perivascular interstitial infiltrate of lymphocytes. Plasma cells and eosinophils are present in some cases. So things we need to remember: Borrelia burgdorferi, Lyme's disease, bullseye appearance, and l- perivascular interstitial infiltrate, erythema migrans. Then this is Bethesda system for the classification of thyroid cytopathology. In the Bethesda system, we characterize the cytopathological findings. It is from 1 to 6. 1 is non-diagnostic or inadequate. 2 is benign. 3 is atypia or follicular lesion of undetermined significance. 4 is follicular neoplasm, suspicious for follicular neoplasm, and fifth is suspicious for malignancy, sixth is malignant. 1 means it is non-diagnostic, so we will have to repeat. Then 2 is benign, so just follow up. 3 is follicular lesion, so follicular it can be carcinoma or it can be benign, so we need to do the lobectomy. And in the 4 it is neoplasm, so lobectomy is done. Then 5 and 6 are for malignancy, so thyroidectomy or near total thyroidectomy is done. We would have to repeat this again and again because it is very difficult to remember in the one read. सो बेसिकली हम कैसे याद कर सकते हैं, 1 तो क्या है, रिपीट करना पड़ेगा, 2 बिनाइन है, 3 में फॉलिकुलर है, 4 में फॉलिकुलर न्यूप्लाज्म है, 5 और 6 क्या है, सस्पिशियस ऑफ malignancy एंड malignancy. Then this is image showing fish. Fish is a technique which is used to stain the chromosome and find different translocations. The fish is basically used. The most important entity which is asked frequently in the exam is fish is used in the CML. In the CML, BCR abial translocation occurs and it is between both the long arms. Both chromosome 9 and 22, both the long arms are translocated. Then this is the image showing the AIDS defining malignancies and non-AIDS defining malignancies. How the question will be asked, basically three options will be given of the AIDS defining malignancy and fourth option will be non-AIDS defining. So they will ask which of the following is non-AIDS defining malignancy. So we need to remember mainly these three. The AIDS defining are Kaposi sarcoma, non-Hodgkin lymphoma, and invasive cervical carcinoma. Other all things which will be given will be non-AIDS, like anal cancer, Hodgkin's disease, leiomyosarcoma, squamous conjunctival carcinoma, and hepatocarcinoma. These three which we need to remember: Kaposi sarcoma of the skin, non-Hodgkin's of the blood, and blood and lymph nodes, and invasive cervical carcinoma in the females. So that were the important images in the pathology section. The next images we will be discussing in the next session. So I hope it will be helpful to you. If you like my video, please subscribe and help me in the further course. I will be thankful to you.